What's been happening in hip surgery recently? Here's a quick roundup of developments in research and hips in the media. Wrightington Hospital's in the northwest of England. It's where Sir John Charney first did hip replacement surgery. There was a recent study which looked at the management of people with early osteoarthritis of the hip on their x-rays and how best to manage them. I did a video on this last year, so have a look at it just to refresh your memory. Have you been told that your hip x-ray is normal, or that the arthritis is only mild? Sometimes the joint doesn't look too bad, and there's no obvious sign of arthritis where we might normally expect to see it. But look a bit more closely deep inside the joint, and there it is. Here's the head of the hip joint that I removed from the patient to do his hip replacement. This is the surface at the top of the joint. It normally wears out first, but here it still looks pretty smooth. The cartilage is quite thick and healthy, but deep inside the joint it's all worn away, lumpy and inflamed. No wonder it was painful. The message from this is, just because the x-rays don't look too bad, it doesn't mean that you don't have an arthritic hip. Sometimes you have to look a bit further, maybe doing investigations such as an MRI or a CT scan. These give a lot more information about the anatomy and the pathology in and around your hip. Sometimes we do an injection into the joint to confirm the diagnosis. Here's a short video on how that's done. Before I do the injection, I identify the correct anatomical landmarks to help get the needle in the right place. We have an X-ray machine in theatre which helps me to do this. I draw some lines on the side of the thigh to make sure I know where I am. I prepare the skin using an alcohol-based solution of chlorhexidine. This makes sure that all the bugs on the skin surface have been eradicated. I'm doing this injection under local anaesthetic. Sometimes we do it under a general anaesthetic, especially if patients don't like needles. I draw up the compounds I'm going to put into the joint. The first thing that I inject is local anaesthetic into the skin. This numbs the skin surface so the patient doesn't feel the needle going in when I do the hip injection. It's really important that the needle goes into the joint itself, not the soft tissues around it. I use the X-ray machine and a small amount of contrast which is injected into the joint. This shows me where the needle tip is before I put the drugs into the hip joint itself. The needle needs a bit of a shove to get it into the hip joint, but once it's there, I then inject the local anaesthetic and steroid. This takes only a matter of seconds, and as you can see, the patient is quite unperturbed by the whole episode. The whole thing only takes a few minutes. The patient then goes back to their room, has something to eat and goes home. This patient was actually completely pain-free when I reviewed him 10 or 15 minutes after the injection. The take-home message from this is that we treat symptoms, not x-rays. So what's my advice? Have a detailed assessment from a specialist hip surgeon. Only a surgeon like this has the training and the experience to make a firm diagnosis and to do whatever is necessary to help you. Well, I would say that, wouldn't I? In other news, Liam Gallagher, the former Oasis singer, had hip replacement surgery earlier this year. He was understandably very reluctant to have surgery, and it's really good to see that he's made such an excellent recovery. He's been tweeting about it, and from what he's said, it sounds as though he's on great form. There are rumours that he might be playing Glastonbury this year, and that he and his brother Noel could put the band back together again. What a great result that would be. Over the years, there have been concerns about the materials that we use in joint replacements and whether or not they're harmful to health. A study from Scotland looked at cardiac, that's heart function, in patients who'd had received implants made from cobalt chromium alloy. Hip resurfacing and some types of hip replacement are made from this alloy. It's tough, it's durable and associated with excellent outcomes. About 15 years ago, we started to see problems with hip replacements where there was a large metal head made from chrome cobalt. We identified this very quickly and stopped using them. In the Scottish study, there are about 30 patients who'd had a special type of ultrasound scan to study heart muscle contractions. Some patients had impaired function. As you can imagine, this has caused quite a stir. A letter in The Guardian from the chairman of the National Joint Registry stated that a study of over 370,000 patients with 14 years of follow-up showed no evidence of an increased risk in heart disease. In fact, in some of these patients, they tended to live a little bit longer. Always read the small print. Thank you for watching. If you've got any questions or comments, then please leave them below or get in touch. The details are in the description below. See you all again next time.